Chrons disease belongs to a group of intestinal disorders called inflammatory bowel diseases. There are two types of this. One is Chrons disease, another is ulcerative colitis. In these problems, there is an immunological abnormality which causes the body to fight against its own intestinal cells, and this can lead to various complications. What are the symptoms of Chrons disease? Chrons disease can affect any part of the intestine, starting from the food pipe to the stomach to the small intestine, large intestine, and even the anal canal. According to the type of the segment of intestine affected and the type of complication, the symptoms can vary. Most commonly, patients with Chrons disease present with repeated attacks of abdominal pain which has not been diagnosed. They can present with diarrhea, they can present with mucus in the motion, and rarely patients can present with recurrent formation of fistula around the anal canal, which is basically a pus discharging sinus around the anal canal. Only late in the disease is the diagnosis made many times. And what are the treatment options for Chrons disease? The treatment option is majorly medical for Chrons disease. If a particular segment of intestine is very severely damaged and it has become narrowed and tight, or if there is an ulcer which is continuously bleeding, or if there is any other complication like the intestine has formed an abnormal connection with another organ or a urinary bladder, only then is surgical intervention needed. Medical treatment generally is quite effective in treating majority of Chrons disease patients. Only a very few patients do not respond to medicine, and even for them there are very latest monoclonal antibody therapies which have increased the rate of treatment success. There is always a small risk of developing cancer in patients of Chrons disease, and they have to be on regular lifelong follow-up for this condition.